Hello and welcome to Medical Dialogues. I'm Dr. Bhumika. Let's look at today's top medical news. CMAJ study reveals alcohol-related deaths jumped 18% during pandemic. Alcohol-related deaths increased 18% during the pandemic, as did hospitalizations related to alcohol use, according to new research in Canadian Medical Association Journal. To understand the effect of changing patterns of alcohol use during the pandemic, researchers looked at deaths and hospitalizations between 2016 and 2022, comparing a pre-pandemic period and a pandemic period. They found that deaths from alcohol use increased about 18% over the 3-year period, with higher increases mainly in 2020 and 2021, resulting in 1,600 more deaths than expected. Alcohol-related hospitalizations also increased 8% over the pandemic period studied, with higher increases in 2020 and 2021. There were regional variations, with the highest increases in the deaths in the Prairie provinces and in the British Columbia, excess rates 3 times higher than in Ontario and the Atlantic provinces, and 6-7 times higher than in Quebec. Hospitalizations were also higher in the Prairies and especially in the Territories. Younger adults had the highest increases in both excess deaths and hospitalizations. Air pollution linked to increased hospital admissions for lower respiratory infections, study finds. A new research showed that long-term exposure to PM2.5, PM10, NO2 and ozone air pollution is associated with more hospital admissions for lower respiratory tract infections in adults. The associations were stronger in men, people over 65 years of age, and those diagnosed with hypertension. The results have been published in the journal Environment International. Researchers from the Barcelona Institute for Global Health assessed the effect of air pollution on hospital admissions for lower respiratory tract infections in adults and investigated the existence of subgroups that are particularly vulnerable to these infections. The study involved 38 lakh adults from the COVARE-CAT cohort. The research team used exposure models to estimate annual average concentrations of PM2.5, PM10, NO2 and ozone during the warm season between 2018 and 2020 at the participants' residences. Information on hospital admissions, mortality and comorbidities was obtained from various administrative databases. The study included hospital admissions for all lower respiratory tract infections and separately the subgroup of hospital admissions for influenza and pneumonia. A statistical model was then used to assess the association between air pollution and hospital admissions. Clinical trial shows benefits of high-precision radiation therapy for metastatic cancer. A new phase 1 clinical trial from London Health Sciences Centre Research Institute has found high-precision radiation therapy is safe for use in patients with cancer that has spread to more than 10 spots in the body. Published in the International Journal of Radiation Oncology, Biology, the ARREST trial highlights the potential for this therapy for patients with limited treatment options. Past research from LHS-CRI has shown that targeted radiation called stereotactic ablative radiotherapy may be beneficial for those with cancers that have spread or metastasized to fewer than 10 spots by showing it can lengthen the time until new cancer spots appear and in some patients lengthen their lifespan. The study aimed to assess the safety and feasibility of using stereotactic ablative radiotherapy in cancer patients with polymetastatic disease where the cancer has spread to more than 10 spots in multiple organs throughout the body who have very few drug treatment options available to them. Thank you for watching Medical Dialogue. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.